Orbach. I practice chiropractic here at the World of Wellness. I also hold the designation of being a primary spinal practitioner. And I've been practicing here with this group for 15 years. That means I had a chance to practice on the South Side office on Carson Street. And we moved to this building in 2008, conveniently located between major highways 79 and 376 in the Green Tree area. So if you're in metropolitan Pittsburgh, we're accessible. Um, and I've been in practice for a total of 21 years. So in that time, I've had a chance to see a few really cool things and do a few really cool things and meet a few really cool people. And on that note, the first thing I want to do is highlight Dr. James Weiner. Saturday, December the 3rd, was the 5-year anniversary of his passing. He, of course, is the founder of what we do here. It's been more than capably taken over by Jamie Dorley. But I think we got to take a moment where I'm going to tell a Dr. Weiner story in the efforts of just kind of keeping his memory alive and making sure that we know. I met Dr. Weiner on July 4th weekend of 2007. I was not exactly certain that I was having a job interview at the time, and I don't think he was either. But we had met online and we shared some common ideas about health and chiropractic and where we fit into the scheme of things. And we'd had some interesting banter back and forth online. And because I'm originally from Pittsburgh, I was in town to visit family, and we arranged to have lunch. And he was in a hurry, and I wanted to get back home to see my family for July 4th festivities. And 2 hours later, we were still at the Indian buffet eating and talking, and he's telling me about his practice, and my phone is going off from all the people who were expecting me, and his phone is going off from all the people who were expecting him, and we're just sitting there having a good time. And at the time, I was practicing with a group in Virginia where we were 6 clinics under one ownership. And we would meet periodically and just go over what we were doing and talk about the business and talk about clinical stuff. And the owner of the group was maniacal, absolute maniac about us faxing in our daily reports to the central office. And so whenever he would come in a bad mood to these meetings, we'd look at each other, we the associates and the practice managers, be like, which one of you screwed up the stats? Why is Eric all upset? So Dr. Weiner and I finally wrap up our conversation, and we're about to go our separate ways. And he looks at me and he says to me, and I think that this might have been one of those rhetorical questions causing this awkward moment. And he just says to me, Dr. Orbach, do you know why this is all working out so well for me and things are going this great? And I'm like, I don't know. I've never even seen your practice. I've never watched what you do. We're just talking, but I got to come up with an answer. And so I said, well, I guess you have excellent control of your stats. And he smiles this big gaping smile, and you can hear the little angels playing their harps, and that's right, I control the stats. And so I know every single one of you listening in has either met Dr. Weiner or knew him or at least have heard of him when he says things like 62% of the people who do X, Y, and Z end up with problem A, B, and C. And that's why you have to stick with me, because you want to be one of the 38% who doesn't have 100% of the problems. So Dr. Weiner, Stat Master, wherever you are, I hope they're rolling out well for you. All right, well, I think that's really that's my personal recollection of working with Dr. Weiner, and I know that a lot of other people have their own recollections, and I think that it's really important that as long as we have a facility here and we're doing what we're doing, that we at the very least remember his name and call attention to who he was and what he did. So anyhow, as I told you guys, I've been in practice for 21 years, 15 of which have been spent here with this group, and what I do is really simple. I do high velocity, low amplitude chiropractic adjustments to the spine and the extremities. Sometimes, every once in a while, I do one of these maneuvers and you hear a popping noise. I love that noise. Technique number 2 is I do some trigger point therapy, muscle release techniques. Technique number 3 is I do what's called active isolated or proprioceptive neurofacilitated stretching, especially to hips and shoulders. So I work full spine, muscles from head to toe, extremities. I work on feet, knees, hips, ankles, wrists, you name it. And I use hands-on technique. And it's very important at this point in the presentation that everybody understands that I use techniques that affect muscles, connective tissue. When I say connective tissue, I mean ligaments, which connect bone to bone, tendons, which connect muscle to bone, fascia, which lives in between layers of muscle, so it essentially connects muscle to muscle. And I work on the joints as well. So it's important that I make sure that everybody understands that this is a wide range designation where I'm treating 3 very critical areas, and we're going to explore that in depth and more of the why as we go along. Now, I use nutritional supplementation and focused, targeted, low-tech rehab in order to reinforce the treatments that I do. Now, my colleague, Jeffrey Nisnik, my colleague, Dr. Tracy Strout, those people use nutrition as their primary technique and their primary treatment modality. I use it as a supplemental. So I've been accused of thinking that nutrition is second most important. And for the patients that I see, by and large, it is. For what we do here, there are people who the nutrition is so much more important than hands-on technique as well. And that's why we're lucky to have a state-of-the-art nutrition store right here in this building this very week. We have big discounts on all the products. We have presentations by practitioners. And we have people who can help both with neuromusculoskeletal issues as well as the nutritional issues. Let's stop for just a split second and do one of my favorite things. We're going to do deep breathing exercises together. So what I would like is for everybody to sit up as straight and tall as you can in your chairs. I want you to take your shoulders and just kind of roll them back behind you, and they're going to stay in that position. Your shoulder blades, the wings in your back are going to be tucked down like they're headed towards your belt. Your head is going to be up, and we're going to make ourselves long in our torso. So think about getting as maximum height and length as possible in between your belt buckle and the bottom of your chest. And what I want everybody to do is to inhale through your nose without elevating your shoulders and allowing this area of your body, this midsection, to lengthen and get even taller and even more filled with this delicious oxygen as your diaphragm engages and your lungs start to expand out into the periphery. We're going to hold that breath and blow out through your mouths in slow, deliberate fashion. And let's do that again. Big, deep breath in through your nose. Everything is expanding. Being long in our torso. Head is up. Shoulder blades are down and back. We're sitting or standing very comfortably. And blow out through your mouths. Let's do one more. Big, deep breath in. We're holding some more. And blow out through your mouth. Very good. So when you asked me, so Orbach, what is this low-tech rehab that you're talking about? Well, this was the beginning of low-tech rehab. We don't need equipment, maybe the most sophisticated piece of equipment that we might need for the kinds of exercises that I encourage my patient to do. Maybe a shower towel, some ice, using your own body in positional relief, deep breathing, posture types of exercises. Somebody comes to see me with excruciating pain in their lower back or their neck, or they're getting migraines, or maybe they have an ankle sprain. There's something neuromusculoskeletal wrong with them. And well, what exercises should we do? Well, let's start with posture and breathing. Okay, so what am I doing all of this for? What's the why? Well, I certainly want to help people have better ranges of motion. We want to get rid of tight muscles. We want to have joints moving as full through their ranges of motion as possible without restriction. We want to take a special emphasis on people's posture, special emphasis on people's breathing mechanics, and adjust them in a manner that will be conducive to better breathing, to being able to sit or stand up straighter, to be able to have better balance. The better your posture is, the better you're able to balance yourself. So those are my clinical motivations. And of course, I want everybody to live as comfortably as possible in their bodies. Really, your body is the only true home that you know. So we're trying to achieve all of that kind of stuff with our patients. And now it's time for big words. Why else are we doing a combination of chiropractic adjustments, muscle stretching, trigger point muscle release, low tech exercises using proper biomechanics, emphasizing good ranges of motion, emphasizing breathing properly, emphasizing the way we're able to walk using our hips, our legs to be able to move both forwards and backwards as we walk. What we want to do ultimately is we want to suppress the nociceptive afferent pathways, and we want to excite the descending inhibitory pathways. Okay, nociception, big silver dollar word. Descending inhibitory pathways, big silver dollar words. And we're going to get to that. But somebody named this speech for me. For those of you that know me or follow me or have listened to me before or pay attention to what I'm up to, I've always talked about chiropractic and adjusting and how it all affects the nervous system, which is really what we're getting into today. But somebody named the speech Dr. Orbach's 5 favorite formulas. I knew I was speaking today. It wasn't a mystery. I wanted to be prepared for it. I wasn't hit by surprise. So, as usual, when I speak, I wear one of my favorite ties. I planned in advance. I got my haircut last night. Shout out to Sarah Schauk. Awesome haircut. And don't you know it? Don't you know it? I cut myself shaving this morning. Better than 30 years of experience of taking a knife to my face and scraping off those little unwanted facial hairs. And of all days, today I had to cut myself. So you want to know a bonus formula, Dr. Orbach's favorite formula, number 1, that we're going to mention in this workshop today is colloidal silver. Colloidal silver has many, many uses. We can boil it down, nuts and bolts, and say it's an antimicrobial. It kills virus and it kills bacteria. So if you're going to cut yourself shaving, or if you haven't necessarily cut yourself shaving, but you want to prevent razor burn, my purpose for colloidal silver is I use it as an aftershave. We're done. On occasion, I might have a teaspoon of colloidal silver by mouth to help if I feel run down, if I feel myself getting sick, if I feel like I'm really more congested in my sinuses than usual, I use colloidal silver for that. So far, not 1, but 2 shameless plugs. One is for Sarah Schauk. You want to get your haircut. She does makeup for weddings and for horror shows. She's awesome. Shameless plug number 2, colloidal silver, and there'll be plenty more shameless plugs as we go along. But right now, let's talk about nociception. Remember when I said I do chiropractic care for joints, connective tissue, and muscles? Nociceptors are what are called receptors. They receive and transmit information into the nervous system. So what a nociceptor does is it receives information when body tissue is harmed or damaged or injury is about to happen or maybe injury has already happened. And nociceptive afferent pathways, afferent means that we're moving from the body to the brain, become excited when what happens? Well, we might have a change in the mechanical stimulation. Like for example, pressure. Putting pressure in a disadvantageous way in the body will excite nociceptive afferent pathways. We're going to put pressure into a body part. That body part, the receptors are going to understand we're under pressure, mechanical pressure. It might be a strain. It might be too much stretch. It might be I fell and landed on a body part and the impact from the ground caused me this pressure. And the receptors in the skin, in the tendons, in the muscle, in the joint, in the ligaments, the fascia, the connective tissue, receive that information and start transmitting it into the information into the nervous system to ultimately alert the brain, we're in trouble and we're going to have a problem here. What else would trigger a nociceptive activation? Change in temperature. How many people out there listening in live in a climate like Pittsburgh, Pennsylvania, where it's, I guess we qualify as middle of December. Now we're not middle of December at this point, but it's rainy and it's 60-ish degrees. Could have been 15 degrees, could have been 10 below zero, but it's 60 in Pittsburgh, Pennsylvania. I'm not complaining about the weather, don't get me wrong, but this change from hot to cold to warm, back to hot, back to cold, that kind of temperature shift will also shift the barometric pressure. And so the temperature change and the change in the atmospheric pressure up against our bodies, pressure compressing nociceptive afferents, could indicate or could lead to pain and discomfort. So I can't say not a day goes by, but I can certainly say not a week goes by that a patient will tell me how much more pain or discomfort or how much worse their problems have escalated to, and they say, I think it's the weather. You know what? I think so too. And you know what? Neuroscience agrees with you. I should give you a shameless plug for what I'm drinking, but I want to save it for my formulas and the magic as we roll along with the workshop. Yes.
Is there a colloidal silver brand you recommend for somebody's clientele? Brand?
Okay, the question is there a brand of colloidal silver that I recommend? We have colloidal silver from two different brands. One is Olympian Lab and one is the Argentine 23. I am biased towards the Argentine 23 for the very simple reason that they have a number of different bottle shapes and sizes. Some come in like a squirt bottle. There's a very viscous gel. There are larger bottles of just colloidal silver liquid, exactly the same thing that you might get in the nasal spray bottle. It's the exact same thing you might get in the squirt bottle or spray bottle. I'm voting for Argentine silver based on the delivery system, not to diminish the quality of the Olympian Labs product. They're both excellent. Okay, so far so good?
Good.
All right, so neuroscience agrees with you. Temperature, barometric pressure, the weather, it will excite those nociceptive afferent pathways, and it can lead to a combination of what's called autonomic concomitants, which we're going to get to, and pain. Change in pH. You change in your acid-base ratio in your body can trigger nociceptive activation. So our nervous cells are just, they're charged. They're just ever so slightly negative. And we have what's called a cell membrane. The cell membrane is fat, very, very similar to the kind of fat that you would find in, say, fish oil, like the omega-3D that I'm now shamelessly plugging as one of Dr. Orbach's 5 favorite formulas. So we want to keep the integrity of our cell membrane and we want it to be healthy. So when you have mechanical pressure or a distortion of the cell membrane, now all of a sudden it might become more permeable or different nutrients or different elements can pass through one way or the other. And we want it to be slightly negative. And we're trading sodium on the inside and pushing it out and taking potassium from the outside and pushing it in. And this is actively being transported through the membrane. And that's how we maintain a certain equilibrium. And that's part of the mechanism to maintain, parts of the mechanism that we use to maintain our body's pH. So if there's a failure of that membrane, there are a number of reasons why that could occur. And then we start to become more acidic. Certainly, faulty nutrients that one might find, say, at a fast food restaurant, for example, we're going to alter our body's pH. Certain medications are permeable to the membrane, which might alter our pH. But let's talk about the things that we can fix very quickly and simply with nutrition. we want to keep our pH in a status that's just a little bit more alkaline, a little bit more basic than acid, in order to maintain the health and the integrity of the cell membrane, which we're fortifying with fish oil, one of Dr. Orbach's 5 favorite formulas, which is going to occur by using what's called ATP, adenosine triphosphate. So ATP is the energy that your body creates out of the nutrients that you consume. So we have to have a number of biochemical formulas where we put food, nutrition into our mouth. We transform that food through a digestive metabolic process, and a good chunk of it is going to become ATP, which our body can use as energy. So far, so good? So if we want to have a relatively healthy pH, one of the nutrients that we would put into ourselves would be a green superfood. Shameless plug, another one of Dr. Orbach's favorite combinations or favorite formulas. Let's go with the lean greens or the super greens. So many health benefits to taking those, including the mineral richness. We have it reformulated to include pro and prebiotics. But for the purposes of our conversation, let's focus on the green aspect and talk about the way green foods help your body achieve a healthier pH. All right? So if our pH is healthy, what are our nociceptive afferents not doing? They're not activating. They're not sending messages into the brain that say, it's time to hurt, it's time to be sick. So I can't emphasize this enough. How do we keep healthy people healthy? How do we do a little bit of lateral logic and know that there are disease processes out there, there are viruses out there, there's bacteria, candida, the list just goes on and on and on. Now, I'm not going to take a deep dive into the fields of epigenetics. Your genetics are your genetics, and I'll let people like Tracy Straub, who's a mega genius in these areas, I'll let her go into this in deeper detail, and I'm going to stick with the neuro and the mechanics. But once again, how do we keep healthy people healthy? Well, let's make a checklist. We talked about putting colloidal silver on your razor cut so it doesn't get infected. We talked about fish oil to maintain the integrity of your cell membranes. We talk about greens to help your body stay a little bit more alkaline or basic and not quite so acidic. We talk about the ATP. What do we need to maximize the amount of ATP and to make sure that our biochemical pathways persist? Well, coenzyme Q10 is a big one. If we could just somehow manage to put more coenzyme Q10 into our bodies to supplement the coenzyme Q10 that we manufacture, keeping healthy people healthy. Here comes my next really big shameless plug, because it's actually in my delicious drink here. Power Fuel. I don't think we talk enough about the Power Fuel. Power Fuel, one of Nutritional Frontier's signature products, has contained in it a sugar called D-ribose. Now, I know that we want to talk nutritionally about eliminating sugar, minimizing sugar. D-ribose is a sugar, but this is different. It's extremely, extremely heart healthy. And it also helps to feed our pumps in order to manufacture more ATP. We want to get as much ATP as possible. So we're going to keep our cellular membrane healthy. We're going to keep ourselves at an optimal pH. We're going to feed ourselves D-ribose, which is mixed right in here with my water in the Power Fuel. And we're going to drink a green superfood. Now, in the past, somebody asked me, well, why don't you have the greens in your mix while you're making your presentation? And the answer is a little bit more utility, and that is I told you, I'm wearing one of my favorite ties. I'm wearing a shirt I like. I got a haircut. I shaved. I don't want a green mustache to go with it. That's why I don't have greens in my mixture. Simple as that. Okay, so let's talk a little bit more about these nociceptive afferent pathways. Let's say we're not doing what it takes to keep healthy people healthy. Let's say that we have poor internal health. Let's say we're not taking all the steps that we know how to take in order to maintain the integrity of our insides. That's certainly going to make us more susceptible to have our nociceptive afferent pathways triggered. And let's say that there's a temperature change or there's mechanical dysfunction with the body. Let's say we have a repetitive sprain strain injury through a repetitive motion or repetitive task. Let's say that our pH is off. And what happens is these receptor populations, remember, receptors receive information, they transmit it into the nervous system. The nervous system brings that information through an efferent. That means message in from the body to the brain, nerve to the spinal cord. It travels up the spinal cord, ascends to the brainstem, ascends to the rest of the higher centers of the brain. So far, that's neuroanatomy 101 condensed into a sentence. So nociceptive afferent pathways have an affinity towards the brainstem. Something like 2/3, maybe as much as 3/4 of these nociceptors trigger activity in the brainstem. Now, the brainstem is in charge of vital function. Vital function. Our ability to be conscious, our ability to breathe, our monitoring, keeping our blood pressure down, our heart rate, our ability to sleep. These are all critically necessary for survival functions, all mediated by the brainstem. So if you have bad information that signals harm, being bombarding the brainstem with itself and telling the brainstem that, look, bad stuff is happening. How many people, maybe you've had this experience, some body part, doesn't matter what, let's talk about a shoulder for an example. Somebody's shoulder hurts, but it might be their knee, and it wakes them up at night. They're having restless sleep. They're having diminished sleep. Maybe their blood pressure is off to the races. Maybe they find themselves breathing really shallow. Maybe they find their heart skipping a beat. It's all related. It's all related. This is not coincidence. This is how your brainstem mediates your body, and the brainstem is now being fed information coming from the nociceptive afferent system, not the feel-good centers of your brain. So hopefully you can see how important it is that what we're doing is going to inhibit nociceptive activation. So far, so good? All right. So what do the rest of those nociceptors do? They travel through your nervous system, up through your brainstem, and they bombard what's called your prefrontal cortex with the information that they've released. So what's your prefrontal cortex do? Well, your cortex is in the front of your brain. Cortex is where you have rational thought. In human beings, it's quite well developed. In our four-legged friends, it's certainly present, but less developed. So this is why we hypothesize that human beings are better thinkers than animals. Some people disagree with this. That's a conversation topic for a different day. But our prefrontal cortex is the area of our brain where we perceive pain. So if I fall and I land on my shoulder and my shoulder just kind of jams towards my neck and it all starts to swell up, all of those nociceptors are going to be activated. And when that chemical cascade makes its way to my prefrontal cortex, which really should happen in a matter of a split second or two, I'm going to start having pain, right? And that's going to impact my ability to have rational thought, because rational thought comes from the cortex. Pain is experienced in the cortex. So when the doctor tells you, when somebody has been to half a dozen practitioners complaining about something that the doctors have been unable to find on an X-ray, on a CAT scan, on a dog scan, on a grocery scan, on an MRI, on any kind of visual imagery, and they've tested these people to the point where there's nothing left to test, and they're unable to say your diagnosis is, what do they say? It's all in your head. Where else would it be? Where else would it be? Of course it's all in your head. I don't say that to be dismissive or trite or to say I can't find the answer. I've invested hundreds and hundreds of thousands of dollars worth of testing to bill your insurance. I've been unable to come up with an answer. So now I guess it must be in your head because nothing beats the machinery that I've got. Of course it's in your head. It's right there in your prefrontal cortex. That's where you experience your pain. That's can't be more simple than that. It's in your brainstem. That's where you can't sleep, you can't breathe right, you can't. Your heart skipping beats, your blood pressure is off to the races, your anxiety is going through the roof, and all of that is called autonomic concomitants. When you have, we can talk about functions in two capacities: one, voluntary; two, non-voluntary. If I say, okay, everybody, wave goodbye, you understand the language. You can do that if you want. You don't have to, but you can. But you understood what I asked you to do. You understand what it would take to pick up your arm, wiggle your fingers, and wave at me, right? That's very much voluntary activity. If I said to you, what I'd like you to do is everybody dilate your pupils. And now we got a problem. I mean, that's non-voluntary activity. And no matter how much you wish upon a star, you're probably not going to be able to just dilate your pupils because I asked you. I said, please. I said the magic word. And yet you still can't do it. I don't take that personally. That's non-voluntary activity. We need to have some sort of external stimulus. If I get out my high-powered flashlight and I shine it in your face, I'll bet your pupils will dilate and constrict some more and dilate again. And we'll start seeing this. Will we not? That's because of the flashlight, not because of what you wanted to do to indulge me. So when we talk about the autonomic nervous system, that's all that non-voluntary stuff that's happening, whether you approve or disapprove, it's happening. Digestion, cellular turnover, heart rate, consciousness, blood pressure. You don't have voluntary control over that. And we're going to call that your autonomic nervous system. And then we can subdivide your autonomic nervous system into two categories. One is going to be your sympathetic. That's your fight or flight. That's when I'm all wound up. That's when I'm pretty sure that creature in the back is a saber-toothed tiger and he looks kind of hungry. I'm going that way. Fight or flight, survival instinct, right? And then we also have what's called the parasympathetic nervous system. Parasympathetic nervous system puts you into sort of a wine and dine, rest and digest phenomenon of a mode. And what's that doing? It's slowing you down. It's slowing your heartbeat. It's relaxing or it's calming your blood pressure. It's allowing you to sleep. Nothing is all good. Nothing is all bad. We absolutely have to have both a sympathetic and a parasympathetic nervous system, even though the sympathetic nervous system gets us kind of wound up and fightish or flightish, kind of like I'm getting all wound up, excited to talk about my favorite topics, neurophysiology and chiropractic and how the two work together. All right, so that's sympathetic versus parasympathetic nervous system. So let's think back to everything we've talked about these nociceptive afferent pathways. And those nociceptors, they send information 2/3, 3/4, depending on which researcher you're believing or following, to the brainstem. So when you have tissue destruction in the form of a sprain strain injury or mechanical pressure, or you have a change of pH in your body triggered by a failure of your cell membrane to be permeable to the right stuff at the right time in the right amounts, or your temperature, the external temperature, does not match what your body is capable of adapting to. Before we have pain, a better gauge of what's going on is going to be, have you been restless? Have you been, have we noticed a change in your blood pressure? Have we noticed a change in your heart rate? These are the kind of things that go hand in hand with one another when you're examining and interviewing and coming up with a plan as to how to treat these patients. When I say these patients, I mean that's virtually everybody. I'm a chiropractic patient. How do we keep healthy people healthy? Well, that's part of the recipe, and we're going to get to that. So how do we help these people? The first thing we got to think about is what kind of a treatment plan would we have where we would inhibit nociceptive afferent pathways. We know that nociceptors live in muscle, in joints, and in connective tissue, as well as organs and skin. What would be a pretty good idea here? Let's come up with a treatment plan where we're addressing muscles, tendons, connective tissue, occasionally skin, occasionally organs, doing hands-on chiropractic care, doing exercises, low-tech, easy exercises to reinforce the chiropractic care, and at the same time, uh, um, knowing that we can add nutrition, certain targeted products, certain targeted metabolites, which will further influence or augment the hands-on chiropractic care. So I don't slam anybody. I don't have a negative thing to say about my professional colleagues. Uh, there are a lot of right ways to practice chiropractic, and I do not have a monopoly on them. I have not, as hard as I try, I've not been awarded title of spokesman for the profession. I don't have a right to influence anybody else in how they practice. But for the people who are listening in, who have mentored me, who have been my mentees, who have been my patients, I mean, you know very well that we do a combination of chiropractic adjustments to the spine and the extremities. We do trigger point muscle release, and we do that proprioceptive neurofacilitated active isolated stretching, mostly to affect the tendons, but certainly to affect the whole system. And we do this so that our patients can breathe deeply and easily and freely, so that we can have better posture, so that we can have better balance, so we can better movements, better body movement mechanics, and feel more comfortable in our bodies. And we do that with the knowledge that what we're doing is, in the process, we're inhibiting nociceptive afferent pathways, which are going to suppress pain and suppress those autonomic concomitant factors that we talked about. So, what else do we do? For a second, let's get a sip. Let's take a break from the workshop, and let's do a little bit more deep breathing exercises together. So, what I want everybody to do, once again, we're going to be as tall and as long as possible as we can be in our abdomen. And when you go to get your height measured, you want to be as tall as possible, and you want to squeak out that last eighth of an inch if you can. So think about the tallest point on your skull is going to be the highest point. And we're going to take our shoulder blades and we rock them backwards, so our shoulder blades, the wings in our back, almost feel like they're pointed down, and they're going to we're trying to touch our belt with those shoulder blades. It's certainly not going to happen, but that's what our visualization. We're going to breathe in through our noses and feel our whole body, our whole torso expand as we suck in the delicious oxygen. And then we're going to blow out through our mouths and feel this all compressed, like we have a light belt just pinching ourselves in. But what we are not going to do is shrug our shoulders up to try and create bigness this way. Okay, so big deep breath in through your nose. We're going to hold, and we're going to hold, and we're going to hold some more, and we're going to blow out through our mouths. Again, big deep breath in through our noses. And we're holding, and we're holding. And we're going to hold some more, and we're going to hold again, and blow out through our mouths. One last time, big deep breath in through our nose. Holding, holding, holding again, and blow out through your mouths. Okay, so far so good? All right, so we've really beaten this nociceptor theme of what they are and what they do and how disadvantageous they can be for us. We gave that topic, or that thread, a good thrashing. Let's talk about ways to stop them or slow them down. Number one would be their counterbalance, what we're going to call the joint mechanoreceptors, or the mechanoreceptors afferent pathways. Remember, afferent means we're going to take information from the body and send it up to the brain. Efferent means it's coming from the brain down to the body. So we have these joint mechanoreceptor afferents. Now, where do joint mechanoreceptors live? Same place nociceptors live. In joints, in muscle tissue, in connective tissue. That means tendons, ligaments, fascia. Lives in the skin, lives in organs. And mechanoreceptors, their afferent pathway, what they do is they fire to affect parts of the brain that will allow us to orient ourselves in space, to have better balance. And those parts of the brain act as checks and balances to inhibit the nociceptive message. So if we're doing a chiropractic adjustment plan that includes making a high velocity, low impact, or low amplitude thrust into a joint, maybe we hear a popping noise, maybe we don't, we're exciting joint mechanoreceptors. So if you've ever had the experience of being my patient, or hopefully one of the patients of my mentees, certainly a patient of one of my mentors, you might go and see the chiropractor and say, I really have a lot of pain and a lot of discomfort in my upper middle back. And we're going to talk about it and drill down and figure out what's moving and what's not moving. When I mean moving and not moving, which muscles are stuck, which muscles, which joints are stuck, where are the adhesions and the restrictions, how are the push-pull relationships between body tissue functioning. Are you suffering from a problem where you have too much movement? Are you having a problem with too little movement? What can we do to fix it? And then when it comes time to do treatment, you might find that we're adjusting your feet, or we're adjusting your hands, or maybe your hips. And you think to yourself, this guy doesn't listen. He told me, I told him very clearly, my problem is between my shoulder blades. He examined me, he checked, he explained to me what's going on. What's with this business of adjusting my feet? It feels good, but it's not what I'm here for. Well, yes, it is. What you came here for, presumably, is to have your joint mechanoreceptor afferent population stimulated so that we can fire off input into your brain, so the brain can use that input to in turn to inhibit the nociceptive problems, so we can make some of this autonomic concomitants go away, and so we can hopefully make some of this pain go away. So this is why I come from a camp. I mean, I wish I thought of this on my own. I wish I created all of this, but I didn't. I didn't even come close. I learned from people who were absolutely brilliant at what they do. I should start mentioning names like Mark King, Mark Charette, Ken Erickson, Ted Carrick. I've learned from some of the most brilliant people in healthcare, not just chiropractic, co-opted it, used it every day in practice, and began teaching others. We treat patients like a whole body system, not like I hurt here, I hurt there, so I'm going to treat you here and there. Mechanoreceptor afferents, what else do they do? They stimulate the cerebellum. The cerebellum is a part of the brain that's chiefly responsible for coordinated movement and balance. If you've ever had the unfortunate experience of being pulled over on the side of the road on a Saturday night, and the police officer asked you to walk along a straight line, maybe to reach out and bring your index finger in to touch the tip of your nose, those are cerebellar tests. Those are straight out of the neuro exam, where we're testing the integrity of the cerebellum, trying to determine whether or not it's healthy. Where's the, neurologically speaking, where's what's called a longitudinal lesion? We're trying to localize a problem. The cerebellum is most susceptible to oxygen deficit. And when the cerebellum becomes oxygen deficit, it makes our balance a little bit trickier. It gets rid of our ability. We don't have the ability to coordinate movement. And alcohol toxicity, alcohol poisoning will deprive the cerebellum of the necessary oxygen for it to function the way it's supposed to. So when the cerebellum is healthy, when it's doing what it's supposed to do, we talk about coordinated movement, we talk about balance. But one thing we don't give it enough good press for is that the cerebellum fires to inhibit the sympathetic nervous system. So when we talked about autonomic concomitants, and we talked about that nociceptive afferent pathway and the way it stimulates the brainstem in an aberrant way, affecting the way we sleep, the way we breathe, changing our heart rate, raising our blood pressure. The cerebellum is going to fire to normalize all of that important stuff. So when we fire off the joint mechanoreceptors, which also found in muscle, also found in connective tissue, organs, and skin, we're triggering the cerebellum to do its job the same way the nociceptive afferents would trigger the brainstem to do wrong by us. So far, so good? Okay. So part of any good treatment plan, in my opinion, includes chiropractic treatments to joints, connective tissue, and muscles. What else can we do to inhibit the nociceptive afferent system? Well, there's a neurotransmitter called Gaba aminobutyric acid, Gaba. So Gaba suppresses nociceptors. So what's the magic question? Well, what nutrients can we take in order to produce more GABA? Please don't confuse this with gabapentin. Well, one is green tea. Two would be magnesium. You start to notice an overlap that so many of these nutrients that we recommend for one thing will have secondary and tertiary and even quaternary purposes in the human body. Magnesium. When I talk to my patients and we try to come up with a very simple nutritional supplement protocol, mind you, I refer to Jeffrey Nisnik, to people who don't necessarily work here, Dr. Ashley Rozzi, Dr. David Sass, to Tracy Stroup, our brains. Tracy Stroup, crazy, just crazy understanding of nutrition. Tracy can treat nutrition from a practical clinical standpoint, and she can teach it from an academic didactic standpoint. Just a complete understanding, Tracy, just using nutrition. My background is in neurophysiology, and I'm used to instructors who rattle off neurological pathways and talk about how A triggers B, B inhibits C, C became inhibited. Now we have to replace it, so we're going to stimulate X in order to replace C. Done. And I listen to them with just awe. Like, man, I wish I could follow the whole thing the way you laid it out. And Tracy talks about nutrition the same way people like Ted Carrick and Ken Erickson talk about neurology. So Tracy, shout out. Anyway, so we talk about magnesium in the sense that, to me, for my patient population, we're doing this to help to relax tight muscles. When we drill down on the magnesium just a little bit further and talk about what it's really doing, we're inhibiting tight muscles, we're building bone, we're helping with digestion, and we're influencing our body to produce more GABA butyric acid in order to suppress those nociceptive afferents. Zinc. Famous, what was the topic here? Dr. Orbach's favorite 5 formulas. I think we're way past 5 at this point, so we entered the bonus round. Zinc, we talk about zinc in the context of what are you going to do for your immune system? Come on, it's flu season. How are we going to position our immune systems better to fight any oncoming viral invaders? Well, zinc has to be near the top of the list of what would you take to do this. Zinc is also going to help our bodies produce more GABA. Likewise, vitamin B6. Okay, so we talked about chiropractic adjustments. We talked about the GABA. Let's talk about another way to inhibit the nociceptive afferent pathway and to get that to just that autonomic concomitants and that pain to just shut down. Dopamine. Dopamine is a neurotransmitter which helps to suppress all of those harmful things that we talked about. How do we get more dopamine? Well, certainly we need to have more sleep. From a nutritional standpoint, we want to have more turmeric or more curcumin. My understanding is that turmeric is a plant. Curcumin is the root of the plant where the healthy properties live. So when you take turmeric, what you're really taking is the curcumin where the healthy stuff comes from. And in order to better absorb the curcumin slash turmeric, we want to make sure that it's blended with either fenugreek and or the active ingredients of black pepper. So if you look at both nutritional frontiers, I think the product is called Turmeric Plus, and the standard processed turmeric is Turmeric Forte, both of which we carry here. You'll see that there are a lot of supplemental ingredients. It's not just the turmeric, but it's the stuff, the good stuff that allows your body to absorb and to utilize something that's really, in general, poorly absorbed on its own. Another good way to produce more dopamine. Music. Listen to music. All I hear in the background is the buzzing of people's voices who are ignoring me, and that's okay. But usually, ever since my colleague Dr. Phil Ross started here, he plays music in his treatment room. And I got to tell you, I'm not hallucinating. I've been here long enough, paying attention long enough to tell you that once he started playing music in his treatment room, the mood here just picked up just a little bit. I mean, not like we were all depressed and dragging through the day, not like we're all bouncing off the walls with enthusiasm, but you can feel an energetic shift, and we feel a difference when Dr. Ross is playing music in his treatment room. Another good way to build more dopamine: meditate. Now, I have a number of mentees, mostly chiropractic students, but a few other young professionals who are trying to learn how to build a clientele and learning how to market themselves or brand themselves. And my first question to them, we sit down and we talk about, what am I doing? What's been successful for me? What are you doing? What can you take from me? How can I help you? And that conversation turns to an end, and then I say, let me ask you a real important question. You meditate? And if the answer is no, then my response is, you better get on that. And say it kind of threateningly, like jump off a table and choke you if you don't start meditating, which is really counterproductive, because meditation, part of it is learning how to be calm. But seriously, when you think about what is meditation, in a sense, we were all doing that with that deep breathing exercise, or those deep breathing exercises that we did together. It's a chance for you to sort of connect your whole body and your brain together and appreciate where your connections may lie, and appreciate where you're disconnected, and you can start to reform your connection. So what I want to do is this. I want to do another 3 or 4 deep breaths together. And this time, while we're doing our deep breathing, once again, long in the torso, shoulders back and down, head is up, we're in a comfortable position while we're sitting. I want you to breathe in through your noses. Feel your torso expanding. But while you're doing that, what I want you all to do is imagine a very comfortable temperature of water that your feet are sitting in, up to your ankle height. And some people like ice water. Some people like the hot tub. Some people like something in between. There's no right or wrong answer. It's the privacy of your own mind. The only right answer is the one that works for you. So just think about your feet in really, really comfortable water as you inhale through your nose and you're taking that big, deep breath. And we're holding, and the water just feels great, and blow out through your mouths. Let's do that again. Big, deep breath in through your nose. And hold, and blow out through your mouth. Again, big deep breath in through your nose. And blow out through your mouths. And let's do that one last time. Big deep breath in through your nose. And hold, and blow out through your mouths. Okay, so really, this deep breathing exercise with the visualization of your feet in a comfortable temperature water, one could say that that's meditation 101. That's how easy it is. So I'll produce some more dopamine this way. Yet another way to produce more dopamine, be out in the sun. Anybody hear me just say vitamin D? I got some iDids in the back. I love this stuff. Being out in the sun, being out in nature, grounding yourself, putting your feet in the grass. Look, this is unseasonably warm for Pittsburgh, Pennsylvania, but I know that I have some very, very good friends in Scottsdale, Arizona, who are going to watch this. I know that I have some mentees in San Jose, California. Shout out from Matthew Chase, who is on the verge of graduating chiropractic school and being unleashed on the public to work the magic that he has already started while working on his internship, while helping patients with migraines by adjusting their feet. Or another way of saying that, Matthew Chase was able to inhibit nociceptive afferent pathways by stimulating joint mechanoreceptors in somebody's feet. Keep up the good work, young man. If you're living in a temperature or a climate like that, get out and enjoy some sunlight. Do it once for me. Do it once for the rest of us here in Pittsburgh, who probably might be a few months before we get that chance, but we'll get it. It'll be here. For those of us who are not in Scottsdale, Arizona, or San Jose, California, let's increase our vitamin D just a little bit over the course of the winter, the cold flu season. Do you some good in a lot of regards, build your immune system, and help you to produce more dopamine in order to inhibit your nociceptive afferent pathways, in order to prevent autonomic concomitants and pain. Let's nip that in the bud. That's what we call lateral logic, thinking steps ahead. And with that, I want to thank you all for your very kind attention. I want to thank my very, very aware staff for actually paying attention to what I was saying. I want to thank IT Savant Phil for making this all happen. I want to thank Jamie Dorley for taking over this business and running it in a way that it should. I want to thank my patient population. And I want to thank Jamie for bringing me a shake.
Your favorite, chocolate peanut butter.
Chocolate peanut butter, no less. And I want to thank Dr. Weiner. Wherever you are, Dr. Weiner, may the green drinks fortified with vegan protein be in abundance, and may the stats be rolling out the way you love them. Thank you all so much.